And then, so after they meet and everything, I'll do an introduction of each of you. I have a couple more. Johanna should be on. Thomasina and Ashlyn are the other three we're waiting.
Okay, no problem.
I'm here, Miss Vickie. My camera was just off at the moment. This is Ashlyn.
Hey, Ashlyn. Hi. Good. I'm glad you're here. Hey. I'm glad.
Miss
Thank you.
Daniels, I'm here too. This is Thomasina.
Hey, Thomasina. Hi. I'm glad you're here. Hey. There's young people knowing technology. They don't come on until it's ready.
Wrong way, I guess.
Thank you. Hey, Pools. How
Hey.
are you all?
Dave's here too.
Hey, Dave.
Hi, I'm just sitting in the back here somewhere. The camera's right.
Okay. And the man with the gray on is Jim. He does technology and audiovisual, anything. That's Jim. Mhm. And Aaron Hobbs is our pastor, and his wife Michelle. Hey, Michelle.
Good morning. How are you coming?
How's everybody? Hi, Aaron. Aaron's the pastor.
Good morning.
Thank you for your message this morning, Vickie. It was beautiful.
Thank you, sis. Thank you. Oh, God, I thank God for it. Thank you. Thank you. And then, Aaron, thanks for the forum and being able to open it up. I want everybody, well, wait till everybody gets on. Hey, Jane.
Hi.
Hi.
It was great this morning.
Thank you. Thank you. God is good. Our God is good. Hi, Carla.
Good morning. Good morning. I
Good
enjoyed your
morning.
presentation
How are
this
you?
morning. Enjoyed the music as well.
Thanks, sis. Thank you. Thank you. Hey, Thomasina. Oh my God, she's gorgeous. Oh, hey, Ashlyn. Oh, good to see you all. Oh, wonderful. Beautiful. Hey, Greg. Greg, the poem was beautiful. Thank you.
Yes.
Hey, Carol. Hey, Deb. Hey.
Nice to see you.
Hey, Carol and Dave.
Joanne.
Yeah, it's good to see you. Well, we won't see what time it is. We can go ahead and start. We won't wait any. And as people join and get on, we got 25 on so much. So we'll start now. Good morning to everybody. I'd like to say good morning. Your mics will say good morning and hello. We have 5 beautiful guests who are here this morning who are going to share and give information about HIV/AIDS.
What do
And
you want to do?
first, I'd like to thank Aaron, Pastor Aaron, for having the courage to bring the ministry of truth here that we can talk and have a conversation of healing and be about the business of HIV/AIDS going away forever. And so, thank you, Aaron, for having that courage to do that. And I want to thank also the congregation of Broadway for opening it up and saying, let's have a conversation, let's be a part of it as a team, and let's work on the solution. So it's one body, one Christ, one body, one Christ. And then, so today, this morning, we have as educators on, we have Mr. Mike Bryson, who is the educator extraordinaire, they say, and he is for HIV/AIDS education and beyond. He's a consultant. He's worked with the Marion County Health Department. And he is here with a fabulous woman, Miss Demeada Williams, who is the program director. Am I right, Miss Demeada?
Program coordinator.
Program coordinator for Women in Motion. And we heard the morning from service from Miss Pam Goodwin. And then we also have Miss Ashlyn Hopkins. Ashlyn is a social worker with credentials extraordinaire, and she is very involved in community activism, and a dear love. I love Ashlyn very much. And then thank you, Ashlyn. And then Miss Thomasina, Miss Thomasina Watts. Between her and Ashlyn, they're just young scholars, these brilliant people.
This is the panel discussion.
Yes, this is the panel discussion. Yes. And Miss Thomasina, before the AIDS, I love it, before the AIDS, I mean, not for the AIDS, before the COVID was in Madagascar. doing her beautiful work. She's a graduate student at Johns Hopkins, proud daughter of one of my dearest friends, Dr. Carla Matata. Oh, and I'm so proud of you, proud of you. And then she's considered one of the great eights of Indiana University. Dr. Juhanna, are you on? I saw you and you went away.
I am here. I am here. Good morning, everybody.
Hey, where's your visual?
I am getting ready to pull over so I can turn it on.
Okay. Dr. Juhanna is one of the great eight, and the great eight are eight African American women who graduated from the School of Education together, eight Black women. And she is having her own television show, doing her business. She's in New York. And the mentors are here, the teachers, the educators, the people who make this happen. Not only are the great students, and as we all are learning, are here, but their educators are here. Dr. Kala is here, and also Dr. Blackman. So we're blessed to be. So I'm gonna let them take it away. I could talk, I could get there, but I'm gonna let them take it away. We'll start with Mike. The panel discussion will be with Mike, Demeada from Women in Motion, Thomasina, Ashlyn, and Dr. Juhanna. They'll have the conversation. Mike, take it away.
Yes, good morning, everybody.
Good morning.
First of all, let me say on behalf of Women in Motion, our Executive Director, Pamela Goodwin, and Demeada Williams, we really appreciate this time to share some information with you about HIV and AIDS. So I don't know exactly how we're going to do this. I don't know if I should pull up my PowerPoint now, or do you want to go and pull that up now?
Sure.
Okay. Well, I'll pull this up and okay, since this is going to be a panel discussion, I'm not exactly sure how we're going to handle it. So I'll just go ahead and put a little information on here, and then at any time, however we're going to handle people jump in or people take over, I'm not exactly sure. So we'll just play it by ear if that's okay. Okay, all right. So again, my name is Mike Bryson, and yes, I have my own consulting services, but I am here representing Women in Motion, who I am also a member of Women in Motion. And Demeada Williams is here as well. Demeada, you want to say something at this time?
My name is Demeada Williams, and I've been a part of Women in Motion since its inception in 2003, along with Mike. And I'm just been pretty much boots on the ground in terms of being there with the people and trying to help the people, and bringing this wonderful opportunity to you guys. And hopefully you'll take and spread this education to everybody you know.
Okay, thank you. And we'd like to start off with Women in Motion mission statement. And their mission statement is education is prevention. And that's truly what we believe. So we try to share as much information, education as we can about HIV. So we're going to go ahead. So my goal for you today, and again, since this is a panel, guys jump in anytime you want. I don't know how we're going to do it, but I do have training goals whenever I started training. And my goal is this: I know people are aware of HIV, and I know people have an understanding of HIV. However, my goal today is that when we leave here, everybody will have a better understanding of HIV, a better understanding of risk, and a better understanding of AIDS. Anytime, please put your questions in the chat room or unmute your microphone, but please let's make this interactive as we can. So now, question for you, my question for everybody here today is this: when is the last time you've seen something in the media on HIV and AIDS? When is the last time you've seen anything in the media on HIV and AIDS? All right, just get at a brief thought for me. We hear so much about the coronavirus now, but let's just say HIV, all right? With that thought in mind, let's look at this, all right? The impact of HIV and AIDS. According to the Center for Disease Control, over the last 30 years, currently there are more than 1.2 million. Hang on one second here while I try to. Okay, there are more than 1.2 million people living with HIV in the United States. That's as of 2018. for the past 3 years. Now, this has changed, but over the past 3 years, for a while there, we were averaging 55,000 new cases every year. And we don't hear anything in the media about HIV. But for a number of years, it was 55,000 new cases. Here's a number I want everybody to be aware of. There could be another 250,000, 300,000 people living with HIV but don't know they have the virus. If they don't know they have the virus, when we talk about risk, that put others at risk. Research has shown that when a lot of people, and I used to say majority, I'm gonna say a lot of people find out they're living with HIV, they do things to reduce the risk of passing the virus on to anybody else. But if we have 250,000 people walking around and have the virus and don't know they have it, they don't do anything to reduce their risk. So that put others at risk. And that's how the numbers continue to climb. So now I'm just gonna go with HIV in women simply because this slide has a lot of historical by the numbers showing how the virus has progressed over the years. So HIV among women, around 1 in 4 people living with HIV in the United States are women. An estimated 284,000 women living with HIV. That was just at the, okay. Of all women living with HIV, around 11% don't know they have it. And among all women diagnosed in 2014, an estimated 62% of them were African American women. 62%. And we know in the United States, I think African Americans make up like something like 24% of the population in the United States. All right. New diagnoses total, and this is just in 2016, there were 39,000 new cases. So you see, we dropped from that 55,000 we had been averaging down to 39,000, which is a good thing. All right. But that is still way too many new cases. This is in 2016. Of those 20 women in 2016 diagnosed with it, all right, 19% of those women made up, 19% of the new cases of that 39,000. All right. Heterosexual contact accounted for 87% of those women diagnosed in 2016. So when we talk about risk, see, later on, I'm going to show you the grant that Women in Motion has, and on there it has high risk populations. And I think people are often misled by that term high risk, because when we talk about HIV, we approach someone about HIV, about testing, about education, they say, well, I really don't have any risk. And that's what too many people think, that they don't have any risk. So understand this, all right, 87% of the women contracted HIV virus in 2016 was through heterosexual contact. So that is a risk. A lot of people confuse high risk with sharing needles or doing drugs, etc. Please don't be misled by that term high risk. Understand what risk is all about. And especially when we're trying to share the information, we need to be aware of what risk is really all about.
Mike, I would like
Yes.
to interject before you move on. Anybody have any thoughts of why heterosexual contact is so high? Anybody have any thoughts for women?
Hello, this is Dr. Juhanna Rogers. Prior to my current role, I served as the Director of Health Services in Syracuse, New York. And as part of my role, I work with the HIV and AIDS prevention education program that was funded by New York State. And our office was titled FACES. And in the probably 3.5 years that I was there, learned a lot about the exposure of heterosexual women and why numbers amongst them were so high. And a lot had to do with relationship dynamics. One being in relationships where their partners were exposing them, and those situations got really complex as we held women's focus groups and just kind of had conversations to dig into not why they were just simply getting infected, or the fact that they were infected, but how it was happening. And what we found is healthy relationships, or the lack thereof, and whether they were in an emotionally or physically abusive situation, ran high on the list. The second matter was finding out that their partner, who they believed to be heterosexual was in fact not being forthright or forthcoming about having sexual encounters with other men. And the third most interesting thing that we found in the work that we were doing around women, in looking at the rising cases or the growing cases within the Black female community, was that some of the women, which goes back to point number one, knew, but because of their emotional attachments or their own thoughts around self-care, didn't feel like they were in the position to change the situation or dynamics that they were in. And so because they were in these relationships, some of them knowing what was happening, they chose to stay and later down the road became infected. And we thought that was important to highlight because it just wasn't simple the matter of who their partner was, but also the emotional and mental well-being of Black women was strong, important to consider as a part of this dynamic.
Absolutely. Thank you. Very good input.
Yes, thank you for sharing that. And that is a lot of what's going on. And also, as you mentioned, being in a relationship with people that are injection drug users. In this next slide here, injection drug use accounted for another 12% among all women contracted HIV virus. So what we want people to understand, and let me show this one as well, but among white women, injection drug use accounted for 28% of those being contracted an HIV virus in 2016. And when we say injection drug use, it may be that they're injecting drugs themselves. Also, it may be, as the doctor was just talking about, they're in a relationship with someone that is injecting drugs. And let me say this about when people are injecting drugs, something we want people to realize is that if a woman or a man is in a relationship with someone that is injecting drugs, that person injecting drugs, what we mean by this, it's not injecting drugs that put them at risk, it's by sharing the works. And people injecting drugs may share works anytime from one time a day and maybe 20 times a day. So that accumulates risk over a period of time. And then when they come home and they're sexually active with their sex partners, that brings that risk right home to them. So we need to recognize that as well, because there are a lot of people that inject drugs that we're not aware of. And as the doctor just saying, they can be in a relationship with someone injecting drugs and they have no idea that they inject, or they do know that they're injecting drugs, but they don't relate the risk to themselves. So that is all a part of the risk. Thank you, Doctor, for sharing that. Here's another one we want you to be aware of as well. From 1987 through 2015, and we say 1987 because this is when CDC first required all doctors to report all cases of HIV. Before that, they were not required to report them to CDC. The doctors could test somebody HIV positive and keep it in their office. However, from 1987 through on now, it's required. And anytime anybody tests HIV positive, it must be reported to the Center for Disease Control. So from 1987 to 2015, all right, more than 94,000 women ages 15 and older died from HIV-related causes. More than 94,000. So just be aware of those numbers there when we talk about HIV. Right?
I want to make a comment.
Go ahead.
When we're looking at numbers like that, for me, I consider HIV/AIDS as a weapon of mass destruction. And I don't know how anybody could argue that when we look at the numbers, a weapon of mass destruction. And we need to take a look at that. It's not about morality. It's not about infidelity. It's about life or death. If we can come together and have these candid conversations, maybe we can kind of slow it up and then get to a point where we can actually eradicate this. But we need to really understand the magnitude of what we continue to see, 30 years into having all these different meds that is helping. But what that is actually doing is allow individuals to live longer with the virus and thus the ability to spread it easier, as opposed to the individuals, they were dying every other day when it first came out.
Absolutely right. And as she's saying, we need to have more candid conversations. We need to have more education, period. We need to have much more education about HIV, because the reason why I asked that question, when was the last time you heard something in the media, saw something in the media about HIV? I just wanted the people just think about that for just a minute. And we're on here as a panel, all right, but and the other people on here as well, but just think about the members in the church, the members in our families, our friends, our community. Just think about, when is the last time they've heard something about HIV? See, currently, when we approach people about this grant that we have now and testing, et cetera, some people look at us and say, oh, I didn't know HIV was still a problem. I thought there was a cure for HIV. See, and it's things like that. See, we need much more education out here and conversation, like you're saying, and groups like the doctor mentioned. We need to be able to sit down and talk about this, because if not, these trends will continue. HIV in the United States in 2018, and again, you can see the numbers have dropped again. 2016, they were 39,000. Now they're down to 37,000. And I'm saying down too, that's from 55,000 every year. So that's a good thing. However, 37,000 is still way too many new cases to be having. You see, we have a vaccine for the coronavirus, for COVID-19. We have a vaccine for that. So hopefully the numbers will start decreasing. We'll not see new cases. There's still no vaccine for HIV. We've made a lot of progress, and I hope to have time to share that with you later. But we've made a lot of progress in that, but dropping down to 37,000 is a great thing, all right? From 2010 to 2017, HIV diagnosis among adolescents and adults decreased 11%. However, diagnosis increased among some groups, and those groups were Black, African Americans, and Hispanic Latinos. In 2018, we were disproportionately affected by the HIV virus. I'll show you some of the numbers. They had a pie chart, but I like to break the numbers down. So in 2018, how the virus disproportionately impacted minorities. There were 37,832 new cases in the United States in 2017. Of that 37,000, 10,000 were Hispanic Latinos. Of that 37,000, 16,000 were African Americans. All right. Do we see how that is impacting the minority communities? We must get more education out here. We must do more testing, but in order to do testing, you have to educate. You have to educate. HIV among African Americans in the United States in 2018, all right, at the end of 2018, it was estimated 1.2 million people living with HIV in the United States. Of those, there were 482,000 were African American. 482,000 were African Americans of that 1.2 million. All right, in 2018, there were 6,678 deaths related among African Americans to the HIV virus in 2018. That's devastating our community. Why African Americans more at risk? All right, at higher risk, around 74% of African Americans do not know their HIV status. In other words, they've never had an HIV test done, never had one done. All right, or in some cases, they had one done, but never went back for the results. Now we've changed how we do the testing. So now testing can be done in just 1 minute. When I first started in this field, it took 2 weeks to get your test results. Things have improved. However, this is ridiculous. 74,000 people don't know their HIV status in the African American community. All right, people who don't know they have HIV cannot get the treatment they need. So unfortunately, if we have time toward the end, I'll try to get that slide in. But unfortunately, by the time a lot of African Americans find out they have HIV, there's already progress in the stage of AIDS. And that's a huge difference. A person who lived with HIV from anywhere from 1 day to maybe 8, 9 years, and they're not progressing to AIDS. By the time it is progressing to AIDS, that means they've had that virus for a number of years. And then by the time they get into treatment, treatment may not be as effective. But don't misunderstand me, because we're talking about people living with HIV and people living with AIDS. We no longer talk about people dying with it, we talk about people living with it. All right. And if people don't know they have the virus, they put others at risk and may pass it on without knowing it. But some of the biggest reasons hurting the African American community are stigma, fear, discrimination, homophobia. All right, plays a big role in the African American community. I'm sorry I took a slide out, but the doctor did hit on what I was on. I had a slide I had in there about men who are bisexual or on the down low, et cetera. I did take that slide out because I was not aware of who was going to be in this audience today. So unfortunately, I removed that slide. But understand stigma, because I feel stigma impacts HIV greater than any other disease. You see, if I had a heart issue, I could walk in front of my church, I could walk in front of my coworkers, anything. So I have a problem with my heart. I'm dealing with that. And people say, okay, man, stay strong, follow your doctor's advice. If I had cancer, I could walk in front of anybody and say, hey, I just found out I'm diagnosed with cancer. And I would have the support of everybody. But the stigma with HIV, if I walked in front as a man, an African-American man, if I walked in front of any group and said I had HIV, before I get that support, I would get that judgment call. That stigma would come in. And in people's mind, I'm sure a lot of people would be thinking, how did he get it? Is he gay? Is he bisexual? Is he on the down low? Is he an injection drug user? All those things come into impact when we think about HIV. If it is a woman, those same things come in. You know, is she a prostitute? Is she promiscuous? Is she an injection drug user? All those things come. Nobody will step right up and say, you have my support. Stay with this. Get into care. The stigma comes in, and the stigma impacts HIV greater than any other disease.
Okay, can we at this time, with our stats and things, can we have conversation now? And with the others panels, can they share? Mike, thank you, you got the information. Thank you.
No problem.
Can you share your screen and go back to
Sure.
open screen with everybody and have conversation? Thanks, Mike, for the info.
I have a question. I'm Deborah Schaffner, and the question that I have is do we need to be focusing on HIV, or do we need to be focusing in the Black community on overall preventive medicine? Because the numbers on HIV are terrible, but they're worse for obesity, heart disease, breast cancer. And it's like if we instead were focusing on overall health, it seems that it would be a very positive impact on HIV, as well as some of those other diseases that are killing us in crazy numbers.
Okay, I agree with that. Anybody else?
I agree with that.
I would like.
Okay, I agree with that observation as well. One of the things that I've learned is for African Americans, it's time that we come out the closet. When I say come out the closet, that just means having that hard conversation we don't want to talk about, whether it's about cancer, whether it's about addiction, that we got to come out the closet and start addressing some of these issues on a holistic level. But I think tackling the one that seems like the elephant in the room, tackling it first, or may bear more fruit than addressing some of these ones that we continue to see year after year after year. Our numbers up in the top 5 in obesity and all those other areas. But it's time for us to come out the closet and start having these hard conversations.
Thomasina, Ashlyn?
Yes, I was absolutely going to say something similar to Demeada. I think that the issue with addressing a lot of these problems is that it's more acceptable. So as Mike mentioned, more people are willing to talk about issues with obesity. More people are willing to talk about interactions or problems with violence and things like that, which may be still difficult and it's a different conversation. But talking about HIV has such a negative association connotation that some people just aren't simply interested in harm reduction techniques or anything like that associated with reducing those numbers. So it's important to continue the conversation about HIV and maybe even extend it to talking about STIs, sexual safety, etc.
Yes.
But it's a difficult conversation for many communities to have.
Yes.
I guess the other thing that occurs to me is if so many people in the community are believing that HIV/AIDS is not a big issue anymore, that people aren't getting infected anymore, I think the obesity and heart disease and all of that is really critical. It's overall health and thriving in society. But if people in the community are thinking that we don't really have a problem anymore with HIV and AIDS, it seems pretty critical to put that out there for discussion and for awareness.
Go ahead. Unmute. She's not unmuted. Can you unmute everybody so they can talk when they need to, Jim?
I can't unmute everyone. They have to unmute themselves.
Okay, got it. Thanks for the AV instructions. Poole is trying to say something. I see her. Unmute yourself. We can't hear you. No.
There, unmute. Okay, I just was wondering how the COVID-19 has affected people with AIDS. Has that made it, is that a factor that causes more deaths from HIV or from COVID-19?
Yes. Yes. Can I address that?
Yes.
Yeah, I'd like to say this. With COVID-19, of course, it's going to impact people living with HIV. If they're living with HIV because they already have a pre-existing condition, if they get COVID, yes, it's going to be much more dangerous to them. However, people living with HIV are no more susceptible to COVID. In other words, they won't get COVID any easier if they practice social distancing. So the difference is if they have the virus, then yes, it could be harmful simply because they have a pre-existing condition. However, if they do not have COVID, all right, they're no more vulnerable to getting it than anybody else, as long as they protect themselves. Okay. Thank you.
I would like to add a recent report from the World Health Organization, which is very important to me because I have HIV and I have lived with it for 43 years. Mr. Bryson, you know my dear brother.
Dr. Brown.
My loving brother, you know, my friend. We're in the fight. But I would like to share with you that the research has found in data across the world that people with HIV do not die any more frequently than people who have COVID-19. That's a powerful a notion to think about and to be sharing among ourselves so that the already traumatized experience of HIV should not be deepened by any more fear than is prevalent in the society, to know that if I was to catch COVID, which I did a year and a half ago, before they told us that it did not exist. And I just about died that one night. I had my last breath. I could not move my arm. By the grace of God, I'm here because I didn't know about COVID because they told us we didn't have any. The point is, here I am alive, and a person can have the eventuality of successfully being able to go through the treatment if they do catch COVID-19.
Thank you.
Thank you, Sharon, Dr. Brown.
Ashlyn, you were
great to see you, sir.
Ashlyn.
Yeah. I'm listening to everything and going back to the one lady's comment in regards to, you know, like focusing on the African American community in respects to AIDS and thinking about all of the other other health conditions that we have out there, such as obesity and stuff. I'm reminded of the ACEs study. I don't know how many of you guys are familiar with that when we talk about adverse childhood experiences. And then what came out of that study in terms of the higher probability, those percentages of when you experience a certain amount of childhood trauma and the things that are more likely to come into adulthood. So we can say that we have heart disease out there, we have obesity, and we can put HIV there in the mix, and what it is that is getting people to make certain decisions. We can specifically say that in the African American community, simply talking about anything is something that is not put on the forefront in the community. So let alone when you factor in mental health, to be able to say, okay, can we talk about what you went through, what trauma that you've experienced? That is not something that people are just readily going to put out there and say, this is what happened to me. And because of this is what happened to me, this is how I chose to deal with it in terms of how I'm coping with it. So I think it has to be a deeper conversation and education about the things that we go through in our community and how we are able to cope with that, and then also that self-care piece too, right? So if we can talk about everything that we went through, then maybe we would not be able to make those unhealthy coping choices, whether it's drugs, whether it's, promiscuity, whether it's overeating, and all of the things that all of those things bring. So even with HIV, tackling more of, what happened to you is also a part of that discussion too.
That's right. Beautiful, beautiful, true.
Yeah, I'd like to comment on that, please.
What I think is interesting about that is I think in the African American tradition, our sense of privacy is, I feel, a little different than you see in the majority culture. My grandmother was not my business is my business. And I feel like culturally, it is a significant difference. We have not historically been a sit on the couch and let me tell you what happened to me kind of people. And I know that that's a generalization, and maybe that's not fair, but I do think culturally there is a difference.
Yes, and you're absolutely right. I'm sorry.
Go ahead. No, go
you're
ahead.
absolutely right about that. So like, if I take like my clients an example, when I come across African Americans all the time, that is it. What happens in this house stays in this house. Everybody don't need to know what's going on. And then when it does happen, then certain things may stem from that. I can take people and reports to DCS or, different type of health things. If I would have just kept my mouth shut, nobody would have even know what was going on. But we have to think about at what point is that okay? At what point that is healthy? Even if we talk about our children and how we raise them and being able to be transparent and being able to talk about certain things in order for them to realize, okay, keeping a lot of stuff in is not necessarily good. There was a study in 2008 that talked about mental health and how it pertains to individuals with HIV/AIDS. And the result of that study was basically saying that the African Americans that live with HIV/AIDS, that stigma-related barriers were a big impact in them needing more mental health care because of the higher rates of mood disorders, and that may have been there after, but more times than not, there were things there before because of things that happened and things that they were not able to talk about. So it's like turning that switch, being able to retrain and in our own community to say, it's okay to talk about these things, but to building up that trust in who can you trust to be able to talk about the things needed for that healing.
Thank you. Thomasina, you wrote something. Will you expound?
Absolutely. So I just wanted to note that in 2008, you mentioned there was a study, and then 10 years later, a similar study was reviewed of Black women and stigma attached to HIV and AIDS. Similar results with Black women because of the intersection of possibly having to be single mother or the influence of stigma, or like the influence of other people like saying that this shouldn't, like testing is difficult, or actually even social and economic difficulties have led to similar results where mental health issues with people living with HIV and AIDS, especially Black people, were far higher than it was in their white or non-Black counterparts.
Okay, I'd like to say something, please.
I'd like to address the issue of holistic preventive care that was brought up earlier. Holistic preventive care for Black women means taking into account the mind, the body, and the spirit. We look at the body often in terms of sections of individual symptoms and pieces, and rather than looking at the whole. And for us, it's so important to look at this in a holistic way. If we are people of faith, then we know it impacts our spirit. If we are people of faith and thinking about the mind, body, and spirit, we will look at this in an interconnected way, from our early childhood experiences, such as Ashlyn brought up, the research that Thomasina has brought up, and the kinds of data that we use must reflect the holistic aspects of our lives. If we do that, then we wind up segmenting. We say, this is about our physical health. This is about our mental health. And one of the things that we must do is think about how these things all come together. That's the holistic approach that is much needed in our African American community. And it has always affected our ability to be resilient and to fight against those harms We have done this for so long, but now is the time for us to see how very important it is to see it in intersectional ways. We cannot address HIV/AIDS adequately without thinking about the mind, the body, and the spirit.
Right.
Okay, I'd like to say something, please.
Right. Thank
I'd
you.
like to say this. During these discussions, I go back to the word stigma. And I will say this, during discussion, I heard the word promiscuous brought up, all right? I have not heard the word sex brought up. In our community, we won't use the word sex. HIV, the biggest route of transmission is not through sexual transmission, it's through sharing needles. However, sex is the second highest rate of transmitting HIV. We're not using that word. I heard promiscuous. Let me understand this. I could be a person who had never been in a relationship before, meet someone, get in a relationship with that person, marry that person, have only been sexually involved with that person, that one person. I'm not promiscuous, but that one person may have had a relationship before me and may have contracted HIV or may have been born with the HIV virus. We have generations of people born with the HIV virus from 1981 till now. We have people born with HIV. I know people personally in their 20s and 30s who were born with this virus. So it's not about being promiscuous. Promiscuous might be a misleading term again. It's simply about being sexually active. It's simply about understanding risk and reducing that risk and having an HIV test done. See, I was involved in this field since 1988. I remember back in the 1990s when Bill Clinton got into office, Ronald Reagan never mentioned the word HIV, never. As a matter of fact, the term was AIDS then. Never mentioned until his last year of office. And once he got out of office, then Bill Clinton got in. Bill Clinton began to put grants into the Black community, into the Black churches to do HIV testing and education. Bill Clinton did this in the 90s. Today, this grant in 2021 by the Indiana State Department of Health is put in there to reach the faith-based community. 30 years ago.
Mike, there's a
30
question.
years ago, we had this grant put in. And still today, we're still dealing with it. And still today, we won't say the word sex.
There's a disagreement. Mike,
Okay.
there's a disagreement with you that we don't use the word sex.
Okay. Go ahead.
Let's have that conversation.
We do use the word sex. What we do is use the word sex, but we don't talk about this enough. Just like you said, Mike, just like Ashlyn has pointed out, just like each of the presenters, we don't have enough conversations where we're using the word sex, and we use these words wisely and with our young people, and affording the opportunity to have these conversations in our churches, in our community centers, and in our schools. These are the kinds of words that we must use. I disagree that we don't use the word. We just need to use it far more often.
I agree with you. I agree with you.
I agree with that too. And I just want to address the promiscuous statement. Since I said it, I was saying that in terms of the study, because they were talking about the risk factors for certain things. So me using the word promiscuous wasn't in response to, like sex overall, and how that is transmitted through HIV, because we do know that happens. We can say that there's a wife, and that she contracted HIV from her husband and had no idea, I think those types of situations are the other end when we talk about being open and honest with ourselves and what we've been through or what we want to go through, but thinking about the other stigmas in the African American community that keep us from doing that. So in terms of homophobia, and then even in the chat someone was talking about with substance use and how there's a stigma there too, and what that looks like.
Yes.
If I could possibly follow up with that conversation, while we do need to have those conversations about sex, I think we all should refocus them to accept the fact that people are sexually active outside of marriage, outside of what is considered acceptable, and then also promote the use of harm reduction techniques such as the use of PrEP and the use of antiretroviral treatment, as well as condoms. I know a lot of people are uncomfortable, but many people do know about them, and having them widely available within and free is an important aspect of maintaining reproductive health for women and for men. PrEP is something that's not as commonly talked about outside of the LGBTQ community. Yes. So I think it's something that might be important for people within the Black community, including heterosexual women, to learn more about using PrEP and also antiretroviral treatment, which can effectively stop the transmission of HIV, which I don't think a lot of people know. Like letting people know that if they are consistent with the use of their medication, that they can live as a person who is who cannot transmit HIV.
Correct. And
I'd
I'd like to add
speak
to
up
that as
and
well.
share with you,
Go ahead.
if I may. First of all, we need the churches like Broadway that validates that Black and white people need each other, and Black and white people have sex with each other. The transmission of the virus started in the white community. It's very important for us to know that this campaign to end HIV epidemic in Indianapolis through the Marion County Public Health Department and our wonderful, wonderful leader, Dr. Virginia Kane, that here at Broadway, we have a wonderful opportunity developing the Hoosier International AIDS Scholarship Fund and creating the Red Ribbon Campaign. And I'd like to invite any of you sisters who are interested in our work at Broadway to please contact the pastor and know that we need you to bring the femininity and the perspective of women so that we can move into our community with a holistic presence of both men and women, Black and white.
Harold,
Yeah.
can you put that information in the chat, please?
Oh, thank you.
And then
Thank
people
you.
can get that information, the connection.
Thank you so much. Thank you so much.
Could I
I'd
add
be
something?
happy to do
Joanne,
that.
I see you getting ready to say something. Say it, Joanne.
But I just had a question about years ago, some movie star came on that his wife had gotten HIV through a blood transfusion, and then she passed it to her 2 children when breastfeeding. I know the wife died, and I know one of the child died eventually. But what is if a baby is born today, is it better chance of survival, or is it still probably eventually going to pass?
Yes.
I will take that question. Can I take that question to Ashlyn, because she deals with that perinatal? Ashlyn?
Yes, I'm sorry, what was the end part of her question?
Are the odds of surviving better now than they were
20 years ago?
Yeah.
Oh, in terms of a infant being born with HIV?
Yes.
Yes, I mean, yeah, that is true. I think there's more that comes with that, though. You know, you think about being born with HIV and what that comes with. This is something that a child, didn't ask for. And then even when you think about the mother, in terms of bonding sometimes, even breastfeeding, we know that she can't do it, things of that nature. So then you factor in postpartum and all of what that brings. I just think it's just different levels to it. We know that they can live and have healthy lives, now before, 20 years ago. So.
Can I address that, please?
Mm-hmm.
Okay, going back to something that I believe it was Thomasina said when she mentioned PrEP. PrEP is a medication that, now here's another misleading thing, because if you see anything about PrEP on television, when it's advertised, normally it looked like it's focused toward the gay community. Yes, it is recommended for men to have sex with men, but PrEP is also recommended as TASP, that's treatment as prevention. So if a woman is in a relationship with someone that is HIV positive and she wants to have a child, now her doctor can prescribe her PrEP, and then that coats the cell so that she will never contract the HIV virus. If the mother never gets the HIV virus, there's no chance that the child is going to be born with it. So those cases early on that she was mentioning about children being born with, there are not many cases now where children are born with the virus. Now also that the hospitals are required to do an HIV test on a woman if she is pregnant. Even if she opts out and says she did not want a test done, they have to test that child once that child is born to see if it's born with HIV. And if it is born with HIV, they apply the appropriate medications at that time. So now with much more advancements, so this is 2021. And another thing I want to say about the medication PrEP, see now there's a thing called U equals U. That's undetectable equals untransmittable. And I believe that's what Thomasina was heading to. Undetectable equals untransmittable. So now if we can get past all the stigmas related to HIV, if we can get people living with HIV, like Dr. Brown, to proudly step up and say, I'm living with HIV. If a person can proudly step up and say that, get on their medications, take their medications every day as prescribed, just like anybody, take them every day as prescribed, they can keep their CD4 count, meaning their immune system strong, and the viral load, which is a loose virus floating around the body, down to an undetectable level, as Magic Johnson. If they can get to this status, they can have sex with their partners without transmitting the virus. Undetectable equals untransmittable. Now, that does not say by sharing needles, but sexually, it is documented by science in the laboratory. Undetectable equals untransmittable. However, we have to get past the stigma, because people living with HIV are afraid to say they're living with HIV. Not everybody, a lot of people afraid to say they're living with HIV, afraid to tell other people that they're on medication. They need to be equally as proud to say that they can take their medication as anybody else fighting any other disease. See, one thing about HIV, it is 100% preventable. 100%. If you don't have it, you do not have to get it. If we don't talk about it in our communities, we will continue to have this virus. And another thing is this. Since 2006, CDC has recommended anytime anybody goes into a medical facility, anything, outpatient, inpatient, your private doctor, someone on staff should ask you if you want to take an HIV test. Now, just give it a quick thought. How many of you have been in a facility, seen your private doctor, and they ask you that question? Most of us probably have not. I've been working in this field for more than 30 years. Not one doctor has asked me if I want to take an HIV test. If we can get past all that stigma and allow people to take a test without worrying about that, take that test. The test is absolutely free. It takes 1 minute to get a test result now. Absolutely 1 minute. So we need to get past it, and we need to understand that the testing is out there, available free. Women in Motion offers the testing free. On East 38th Street, there are a lot of agencies that offer testing free. Marion County Public Health Department, all of them free. But we have to take advantage of it, and we have to educate in order to reach it. People have to understand that they are at risk.
Ladies, I would also like to add to that. First of all, thank you, Brother Bryson. I'd like to say, first of all, I love all you beautiful women, and I'm so happy to be in your presence today. The research also has taken us down the road where we can now enter into the embryonic fluid of the uterus, and we can test the embryo's fluid for the presence of the HIV virus or the antigens of it present, and the baby can be treated through the womb with HIV medication and be born free of HIV.
Wow.
Well,
Discussions. I think very great discussion going on.
can you hear Mike? Are there any other questions for our fabulous panelists here today? Thank you, each and every one of you. Are there any? I appreciate you all. Thank you, Mike. Thank you, Demeada. Thank you, Thomasina, Juhanna. Thank you, Ashlyn.
Vickie,
And let me say a big hello to my daughter that's on here.
Where is she?
And I always forget her.
Where is she?
Ashley.
Hi, Deborah.
And she's in Philadelphia, but she's on, and I want to just say, she's an educator, graduate of IU School of Education. She is in Philly doing great work, and I just got a report that she is one fabulous teacher, educator. So everybody say hi to Ashley. Okay, go ahead.
Yeah, I say hi to Dr. Blackman. Is Dr. Blackman on the call? I saw her name on here.
Yeah, Dr. Lorraine Blackman's on the call. And Mike, she was your educator, right?
Yes, she is my educator. That's what I had that big smile about.
I know when I called her. when I called her.
Hello, Mike. Good to see you.
Dr. Blackman.
And glad to see you continuing to do the work.
Thank you very much.
And
Uh,
and Dr. Blackman gave me the title, my title for today's
okay.
sermon. And
Wonderful.
that is she's my friend, you know, and then a doctor, and we're here with Vice Chancellor from IUPUI, Dr. Calla. I'm just, thank you all. I just want to thank
You
you. I
should be.
thank
This
God
is
for all of you. This is
wonderful panel, wonderful group of people on this call. I appreciate this so much today. This
and
is so uplifting for me.
good. And the young people, you know, Ashlyn and Thomasina, that's what does it for me. The young brilliance that is here
Yes,
amongst
yes,
us. Thank you. I'm full. I'm full. You were gonna say something, Aaron? I'm full.
I was just going to say thank you all so much for being here today. We really appreciate it. And we're glad that the Marion County Public Health Department is making an emphasis in the EHE plan to address HIV, especially in the Black community, because we know it's critical of critical importance. So just thank you all for all of your good work in this area. And we look forward to continuing a relationship with you in the future as we do this work together. Thanks a lot.
Thomasina asked a question. Is there any more questions from anybody?
The only thing I wanted to, it's not a question, but, you know, certainly if there are ways that people at Broadway can support education or outreach, you know, we're supposed to start a farmer's market next weekend. I don't know if there's a reason to have booths or some kind of mechanism for providing information to people, but
so shameless plug for my old job, Shalom Healthcare Center has a mobile outreach center where they move with HIV testing as well as pamphlets and information from different locations around Indianapolis. So if you were interested in like having them come, they can come and do free testing, do some education. And I can connect you with Jay Castillo. They also speak Spanish. So if you have like a large Latino population or have like needs for that, I can definitely give them your information.
Thank
I have
you.
a quick question. Vickie, is it possible that you can share the contact information with everyone, if possible? And that's if you're okay with providing your information to us to network with, set and collaborate on some of these different projects we're discussing.
Oh yeah, you know Pam's my buddy. You know I'm gonna make sure you all have it all together. Yes, that's what I'm about. You know, my sister told me this morning, I talked to my sister on the phone. And one of the things that I love to do is network and connect people to do good works. And that's what we are about. And that's the thing that I love to do. I do it because I love my love of community. I don't need the fame. I think, you know, what I need more than anything is that we work together to do the good works to take care of the needs of the community. That's my thing. I just want to do the good work. That's me.
Yeah.
Yes. So what you said, Demeada, yeah, I'll give you the information. You know, I will. I'll hook you all up so you can, if they're okay with sharing, I don't have a problem with it at all.
Hey, Vickie, before we go, Michelle actually had a question. She moved off of this hard chair over there to a soft one. But anyway, she asked me to ask this question. How could we encourage primary care providers to ask that question about having an HIV test? Is there ways that we could advocate to get some information to doctors to help them to address these issues? Because I think, you know, if they're not asking the question, why aren't they asking the question? And then secondly, the thing about, you know, not seeing a lot of information on television, you know, I think that's very true. And so are there ways that we could advocate for that you can think of or things that we should be involved in? Any recommendations?
Okay. Yeah, Mark has some. Yes, Mark.
I might have a solution. My doctors never asked me about being tested for HIV, but one time, well, my doctor will sometimes have us fill out a survey before we go in to see him. And one time, one of the questions was, what's your sexual orientation? Of course, that made my blood pressure go up. I answered truthfully. And it went back to the doctor, but he never he could have segued off of that answer and, you know, and had that discussion further.
Yeah.
So that's a possibility. But again, when I went in there, I have white coat syndrome anyway. And then when they test my blood pressure, it goes through the roof.
Yeah.
And they, oh, why is your blood pressure up today?
Yeah.
One of the profound factors in this, one of the profound factors in this issue is racism. Everyone here should send a letter to the Indiana University Medical School about its bias. I have lectured in both its dental school and the medical school in the past 3 years. And I ask students to look to the left and right. Do you see anybody that looks like me? And in third year students, there are no Black African-American men. There are foreign internationals, and many of the doctors we see are foreign internationals of color. But the actual admission and the presence of our African-American men are absent in the medical profession. If they're being trained that many years and they're all white, how on earth would they ever have cultural sensitivity to us? And in fact, the statistics and the research bears it out. You cannot imagine cultural sensitivity. It is an experience. And the business of learning in higher institutions of education, and particularly professional schools, is so dismissive of our existence among them that the cultural bias in how doctors treat us as patients and confer upon us the ignorance and the unawareness of the sophistication about our health needs, and our history with our own lives is dependent upon a greater diversity in the medical school, the dental school, and other professional schools. And it will not happen until the heat is turned up by us, the public.
I'd like to say something about the question Aaron asked about getting more information. Why aren't the doctors asking this information? Similar to what Mark is saying, my personal experience is this. All right, doctors have not asked me in 30 years if I want to have an HIV test. I saw a doctor probably 5 years ago. I was going to have some surgery done, and they had to do some blood work. But during that interview, that doctor asked me one question. He said, "Mike, do you have sex with prostitutes?" That was the end of conversation. So after, when I went back to have my blood drawn, I told him no. When I went back to have my blood drawn, the nurse, I asked her, did he order a tube for HIV test for me? And she said no. So I asked her to draw another tube of blood and do an HIV test. When I went back to the doctor 7 days later to get those test results, he told me the test results. And then I asked him, I said, "Why didn't you ask me to take an HIV test?" He said, "Well, I asked you if you had sex with prostitutes." See, that stigma is there with a lot of our doctors as well. So I don't know what it's going to take to get it. And then following up on that, the next thing he said to me, he said, coincidentally, Mike, he had just read an article 2 weeks before that where CDC was recommended that all doctors ask everybody if they want to take an HIV test. See, if the doctors are not asking it, people are assuming that it's done. If they draw 5 or 6 tubes of blood from me and lay them on the table, I'm assuming that one of those is an HIV test. And so a year later, somebody asked about HIV, and I said, "Yeah, I think I had an HIV test." It should not be that way. The doctors have to address this. They have to, and I don't know how we get them there, but it has to be done. We had the same, and the last thing I'll say on it, we had the same similar experience 20 years ago in not Newcastle. Can't think of the little city now, but we went to do some education up there, and the doctors told us that they were not going to ask their patients. They said some of their patients they had brought into the world, and now they had brought their children into the world, and they will not ask them about taking an HIV test. They will not ask them about their sexual orientation.
I have a question.
Yes.
Doesn't it make sense, though, that they would be asking, that we could lobby for a set panel of tests? Because I've had a similar experience where I have a rheumatoid arthritis, which is an autoimmune disorder, and they regularly run blood tests for me. But HIV is not part of that process. But for me to have to ask specifically for an HIV, when it would make as much sense for me to ask for a regular cholesterol test. You know what I'm saying? It should be that there is a set panel of tests that would be like a baseline for determining your overall health.
That is something that a lot of health organizations are working to standardize, having it so that people have to opt out of having an HIV test instead of having to opt in, because studies have shown that having to opt out means that most people will just include it. So yeah, so that's pretty much standard, but however, it's becoming more standard. However, it's not nationally used or even in a part of most health systems. So it's something that more people are considering, but it takes some time for everyone to get there.
As I can tell you, I did ask for an HIV test, but my physician skipped a beat. She complied, she had no problem doing it, but you know, when you're having a conversation and somebody skips a beat.
Oh, yeah, I know. Oh God, I know. Today, I know you're right.
Yeah.
I know you're right.
And that's that. And there was a moment of that awkward, like.
Yeah, right. And again, that's that stigma coming in.
Yep.
Why are you asking for an HIV test? That is that stigma that is there. The impact of stigma on HIV. You know, I mean,
well, you know what the minister said the other day, we were having a conversation. She said this is a rape culture. What does that mean? It's a rape culture. A rape culture. Sexual abuse and things is not addressed with children. When people, sexual abuse is not addressed. It's like in the ways, before you can get to asking questions that relate to sex, we have to first deal with the abuses that we do to our people by the use of sex. And it's not dealt with, it's not handled. We don't want to talk about it. We don't address the people who do it. But when young people are sexually abused, it travels over, and with, she said, the ACE forever in their lives, and it's a part of all their decisions. So we're working with people who maybe have issues that they haven't addressed themselves and asking them to deal and confront things that we have. You know what I'm saying? In essence, they can't deal with.
We're starting a whole different conversation. That's another 2-hour conversation.
But it's an impact. But it impacts when you talk about sex.
And
that's what we have when it talks about sex and sexual abuse.
Yeah, but
these are some of the reasons that stop.
Context of the church is a whole nother thing.
Absolutely.
And this is a church call, huh?
But every one of us got here through sex. Love you all very much.
And we were all born butt naked and ignorant.
I knew some stuff.
Many of us have not finished the process of growing into complete personalities. There is a very important impression that we all make upon each other, believing we're a whole adult. And in fact, because of the wide-ranging discussion about the efficacy of childhood trauma, the issues of disease, the intersection of society and its racism, the colossal manifestation of institutions like the church appropriating people's lives to themselves or the exclusion of them to their institution remains a very profound aspect of where people find their sense of well-being and who they trust to share the most intimate parts of their life and their health. Therefore, we must continue to promote the business of interracial communication and interracial support and overcome racism. And we can do that like we do at Broadway, called the Beloved Community.
Yeah, we got to work with that too. Yeah, because I don't mean to, I love my people and I love people, but with race, we have a white people problem with race. And I'm just being honest. We have a white people problem with race that we have got to deal with. And if I'm wrong, correct me. I want to know. But
it's whiteness, honey. It's not white people. It's whiteness. There are too many good white people who we love and know and who work with us and we even marry. But it is the business of whiteness that is the sociological and psychological blanket that white people hide in, run to when there are problems, or open up and place the burden on those whom they desire to be different from and remain different from. It is the illusion of whiteness that protects individual white people and groups of white people from the confrontation with self that says, I am you and you are me. Ubuntu.
Agreed. Right. And what I'm saying is we get through it because we have the difficult conversations that we must have at all times. But it comes back to we have to teach people to love themselves and be able to be proactive and self-determined in their own lives to ask for the health care that they need. Nobody's coming to give it. We have to empower young people and other people, older people, all people that you are deserving of health. And you need to ask for the things that you need to make sure you're healthy. So we have to empower people in that way. So,
Vickie,
yes,
Vickie,
Mom.
this is Lorraine. My mother is asking a really important question. She says HIV/AIDS comes to the forefront in conversation, in public conversation, and then it dies down. Who's pushing it down? She says.
Ooh, good question.
I'd like to suggest that it's not a push, madam. Rather, it's an omission. Our government, through the media broadcast modalities, promotes a omission of Black face, a Black presence, and a Black need. The idea that we don't own radio stations, we don't own the broadcast TV in Indiana, has led to those decisions that choose what the programming is. Even the public service announcements are omitted, although there are many that should be facing our community. So I would like to suggest, not that I know it all, because it may well be, there is a push down, but I think from my long years of experience fighting in the advocacy since the beginning of Stonewall in New York, it was the omission of us in the creation of the programs like Ryan White Law in 1990. It's
What
the
do you
omission
think, Mike?
today of Black people sitting at there are 8 leaders of the State Board of HIV in the State Board of Health, and they are all white.
Oh, boy.
So the omission of our people's presence, and not only the omission, but the failure to invite and leave a wide open space between our need and the recognition of the presence of a particular disease in our community that needs addressing like it is in the white community. I would offer that as a part of the explanation.
Big Mark, did you want to say something?
Sure. Yeah, I go to Indiana Internal Medicine down in Greenwood. I mentioned about going there earlier, and they're open and infirmary, and they used to have quality stickers and rainbow stickers on the glass doors in the building. And the head doctor there, his name is Dr. William Buffy, and that's Buffie, I believe. And he's published 1 or 2 articles. I cannot remember the title of the article, but it's in a medical journal. But it was a very good article. I can't recall all the gist and details of it, but it was very good and kind of, I don't know if it addressed this topic or not, but it was pretty close to it.
So is it that when it's issues of people of color and something that it only stays in the forefront from a minute and then it disappears? Is that what your mother is asking about? Why does it go away?
Yeah.
Mike, I mean, you've been at it for a long time. Why does it go away?
Well, I really hadn't given it that much thought, but I really lean toward what Dr. Brown was saying. It is an omission, and so, I mean, if you're talking about news media, who decides what's going to be put out there, and when it's going to be put out there? The only time things are put out about HIV is when someone is arrested related to HIV, which is also stigmatizing because they have a disease and they had sex with someone. Now they can be arrested. So that adds to the stigma. So I don't know. I just know that when I talk to people, they say, well, I haven't heard anything about HIV. I haven't seen anything about HIV. So I had not given that a thought. And I'm glad it was brought up. You know, I'm glad Dr. Dr. Blackman's mother Dr. Blackman's mother is still in. I
She
love
is.
I
Her
love you,
mother's
Dr.
on it.
Blackman.
I love her too. Love her.
That said last, I think the article was about stigma and about taking the stigma away that leads to more healthier choices and things like that.
Yeah. Yeah.
We have to be very clear that our professional systems of education have never, ever treated the dignity and responsibility of addressing issues of culture and race and ethnicity and even language difference. In our professional schools at the universities, not just IU, but at the universities, have never adequately, unless they were an HBCU, have never adequately addressed who we are and how we should attend to the issues. This has been a problem that's persistent. And our role, and I think Pastor Aaron had said it earlier, is to be much more of an advocacy body. We need to advocate for what we want, and we have to do it. We have to do presentations before legislators. We have to write to boards of trustees. We have to address this. This has always been the way, not to silence ourselves, but to say we must speak. Our voices must be heard.
Yes.
And that's the only way to affect change. When the media showed George Floyd being killed, people spoke. That's what it took. It took people dying. It took people being able to say, we will affect racism. We will fight whiteness. We will fight oppression. We will fight these things, and we will address these things with love, as Vickie said in the very beginning, with a deep and profound love for each other. But if we don't do it, then we remain passive and only self-comfort, not doing the comfort of our beloved community. And we have to fight the universities and the other institutions that persist in oppressing and marginalizing and underrepresenting us in those professions where change can occur.
Here, beautiful.
Thank you so much. I'd like
Let
to
us,
add this.
you know what, we, Jane,
I would
wait,
like to add this just before you go
Jane,
now.
hey, Jane wants to say something.
Oh, I beg your
She
pardon.
hasn't said anything.
I see.
I thought you put your hand up to say something. I'm sorry. Jane hasn't said anything. Okay, go ahead. Go ahead. Go ahead now, Harold. I'm sorry, Jane. I took that as I want to
I
talk.
just wanted to say, as much as we do want to follow this remarkable urging to solicit connection with the legislature to deal with the presidents of universities and so on. That's extremely important. I must remind you, though, in the long 43 years I've been fighting this battle, it takes a critical incident, as referred to by George Floyd, to move people past the what appears to be a lack of initiative or initiation, but in fact, even in the civil rights movement, it were the critical incidents, the serendipity of the unexpected, that ultimately is the volcanic action that is needed to erupt in people's heart, mind, and souls. And it is important to know that it's the human destiny until we see the actual enormity of murder for 9 minutes. That incident is what galvanized many, many other feet and hands that were marching, who were writing, who were involved, but it didn't add up. It didn't add up. And it wasn't about passivity. It wasn't about unconscionableness or not knowing. Those who have the strength are the ones who are supposed to do. Everybody's not strong enough to do it. But I'll tell you, we must look forward and keep the hope of knowing it will be the serendipity of a critical incident that once more will move us one more step forward in seeking the outcomes we're talking about today.
Thank you. Thank you. Thank you all. I have to say thank you. This has been very wonderful. I thank everybody for sharing and being a part of this. I thank God for the opportunity to share this information for us all to come together and be brought together to grow better. Um, Thank you. Thank you all. And God bless and keep you. We're going to leave. And the information we'll have this on live. This is recorded. So you all can get the information. And thank you, Jim, for your tech and your greatness and pulling it together. And thank you all, Mike and Demeada, Ashlyn and Thomasina and Juhanna. Thank you. Thank you. And I'll say goodbye and blessings on this. Thank you. Thank you.
Thank you for having me. And thank you. Thank you, everybody.
Yes,
Lovely,
thank you.
lovely day.
Aaron, thank you. Thank you.
Thank you. For having me.
Melanie. Yeah. Take care.
Thanks,
Thank
Daniel.
You're welcome, Melanie. Thank you. Love you. I'll see you later. Bye.
All right.
Thank you. Thanks, Jim. Thanks, Mike. It was good.
Thank you. Thank you.
Thank you. It was just, hey, we just have to come together and see what we get.
Yeah. Keep working at it. Wonderful.
Yeah, keep working at it. Thank you
Wonderful.
for your good work. And I'm glad Dr. Blackman said she would surprise you. I'm so
I saw
glad.
her name and I couldn't do anything but smile. So
Thanks, Jim. Thank you. Thank you. Have a good one.